totally agree, and I'm thrilled that you all are doing that. And I think that the last well, I have just a few comments, and I want to open it up for questions. The information, Shaniqua and Becky, that you shared about the public health schools, and I'm not going to put you on the spot, Josh, by asking if, if your public health school require any of these things. I'll just raise my hand as a long time ago MPH graduate. None of the things you said were required for me to graduate, and I won't tell you where I went. I don't want to throw them under the bus. Maybe they've changed since then, but I think that those are really important issues. One thing that I wanted to ask is we're starting to get some chats in questions in the chat, and I'm going to turn to those, but taking a bit of prerogative. Many of you have mentioned this idea that there are sort of literally unprecedented amounts of funding coming into state and local public health that could be tapped into to address and to start to confront some of these workforce challenges that you've laid out. My observation and wondering is how can we support, or what are actions that public health organizations at the state and local level can take to be able to actively and effectively use these funds? I mean, to me, the analogy is like, you know, the terrain is barren and dry from, you know, years of drought. And so when the rain comes, it just runs off the surface of the land instead of being able to be absorbed, because you don't have the capacity to absorb it because of, you know, what has happened before. So how do we support the workforce in being able to use these funds in a way that's effective and strategic when they're often saying, look, I can barely get my day job done. I don't have any brain time to think strategically about transforming the workforce. So I'll throw that out to the panel. I'm going to start with Kyle, see if Kyle has any idea, because I'm sure that may have come up in some of your work, but interested in from all of you.
Thanks for the question. Yeah, I think it's definitely a challenge. It's something we're less used to than I would hope. You know, we generally don't get a lot of resources in public health, so sometimes we get sort of, you know, deer in the headlights because we don't know what to do. And I think it can be hard to leverage those resources effectively, given some of the restrictions around how quickly the money needs to be spent and the different idiosyncrasies and how people need to be hired or recruited in different state and local programs. But I think there are some areas of opportunity. One of them is really thinking more strategically, health department or local health agency wide, and thinking where are there areas of competencies that could be leveraged across disease programs, as opposed to focusing in specific disease programs. There's more flexibilities in sharing of some of those resources across categorical programs that I think state and local health departments are leveraging. I think also thinking creatively in some of the ways that Josh had mentioned is maybe going outside of the typical places where we tend to recruit our population health workforce, and that there are really incredibly skilled people that aren't in places that we traditionally look, like our community-based organizations, and not necessarily the community-based organizations that are health-centered, but there are lots of other community organizations that I think have people with the right kinds of skills that really would benefit public health, and I think would really grow and develop into the next generation of public health leaders. I'll pass to some of my other colleagues to see if they have thoughts.
Thank you for that. That's super helpful. Anyone else want to take that on? Josh is raising his hand.
Yes. You know, I do think it will be a big challenge for public health departments to spend money. And, you know, there are people who show up in public health departments and say, like, you know, we're a contractor, we'll help you do this. You know, they'll all work for us. And the day the money is gone, all the people disappear, you know, and they can say, like, you know, what do you want? How many right-handed people, how many left-handed people, you know, and they come in. Well, I heard the mayor of Chicago, Lori Lightfoot, speak, and she said that one of her mottos during the pandemic for this kind of thing was no temporary scaffolding. She didn't want to build temporary scaffolding in public health. She wanted to figure out ways, even if it was going to take a little longer, to build the capacity within health departments to really be able to to really pivot in the direction of communities. And that's why they, kind of built a community health workforce within the health department for the longer term. I actually think that national leadership is going to be really important here, because even if we were to agree on what a health department should do, if you just kind of shower money on different health departments, they may go in a lot of different directions. And even if half of them do that kind of thoughtful approach, the other half don't, that's a huge wasted opportunity. And so, thinking about as within a month or so, there's supposed to be a big notice of funding coming from CDC, for funding for state and localities. And I think it's going to be very important for there to be some real guidance, because we need to have a basic structure in this country rather than just sort of, a collection of different kinds of approaches. And so I think it's both the thoughtfulness and not rushing to things, but also the standards that across different health departments that I think are going to be really important as this next round of policy work happens.
Great, thank you, Josh. Anyone else want to take that? Becky, Dr. Hanreid, and then we'll pivot to some questions that are coming in.
Well, I just would want to say, and this is not in a deep area of expertise for me personally, but there was a public health law and finance summit last week that was hosted by the CDC Foundation. There are a number of resources on that website that I think people can check out. And if they want to check out some of the proceedings from that, I think would be, for people who are interested, that would be a great resource. They spent several hours on this financing issue during that summit. So highly recommend this.
Thank you. And I appreciate your plug for the CDC Foundation. I didn't pay you. You're not getting any product placement, funding or anything. Marilyn, anything you'd want to say about that? And then we'll pivot to the first question.
I guess I would just echo something that Becky and Shaniqua in particular raised in their presentation, which is I've noticed that among public health students, in addition to, I think, less training in public health law, they also sometimes have less training in just the policy process from starting from the moment a bill enters the legislature to an actual appropriation. And so if we can, I think people at top level leadership positions in state and local agencies tend to have that information, but I think people at the mid levels and lower levels generally are not keeping track of things that are going on in the legislature, but perhaps they should, especially if they have an idea that could be very compatible with a new emergency or one-time appropriation. So this is the only thing I got to add.
Yeah, no, that's so true. And, add that to the public health law, law and policy, all together. So we've had several questions come in that are related to ramping up the public health workforce by tapping into nurses, public health nurses, other kinds of people who've been trained in nursing of different types, and having those folks come into public health. Wonder what you all think about that. And as I throw that over to you, I think the salary question that Becky and Shaniqua brought up has to be relevant there, because depending on what kind of nursing people are trained for, chances are they can, get much higher salaries if they do clinical care than if they go into public health nursing currently. But what do you all think? Josh?
Lauren, when I told my mom, who's a pediatrician, that I was going to be a pediatrician, her comment was, "I guess you don't want to make any money." That was kind of her immediate comment. And
I heard that too. Thank you.
Yeah. So there are a lot of pediatricians in public health. In part, it's because the salaries compete reasonably well with being, or maybe it's because with being a pediatrician, as opposed to, you don't see too many cardiovascular surgeons as health officers. I think that it is important that people are paid well and fairly, but I don't think it's realistic in the short term we're going to see salaries that really compete with clinical salaries, like serious clinical salaries. And I think, though, that there's still a lot of great people who go into public health despite that, because there are enormous rewards for doing it. It's been very challenging during the pandemic because some of those rewards have been taken away, particularly by the harassment and mistreatment that people have experienced. And so I think that, supporting the public health workforce does include salary, but it includes all these other components also. I think, public health nursing has an incredible history, just an incredible history, and well beyond just, giving shots or being the school nurse. Public health nurses have developed some of the most important public health programs. Many of them have done incredible work on related to the social causes of health, bridging the gap between the medical side and the social issues. I think reinvigorating public health nursing and investing in that path, maybe through loan repayment, like Kyle had mentioned before, is totally worthwhile given the situation that we're in.
Anyone else wants to? Yeah, Kyle.
I did want to just add one thing off of something that Josh had said, and it's a little bit off the nursing topic, but I just wanted to mention that the same market pressures with respect to public health versus clinical care really impact a lot of our workforce with respect to public versus private, particularly in the domains of laboratorians and informaticians and data scientists. And it's really challenging because those are highly technical fields. And I think we as a collective train them very well, and then there's just better opportunities outside of the public sector. So I can't begrudge anyone for leaving a health department to go work at Apple or Google, but I think we have to be realistic about how can we compete. And I'm glad that Josh brought up the loan repayment, because I think that's one lever that we have. But I think we need to be really strategic and I think really pragmatic about what is possible, given that there are some market forces out there that the folks in nursing see as well, that we maybe not necessarily have complete control over.
Totally agree. And I appreciate Josh you bringing up the idea of the support that's beyond the financial remuneration, but what other very meaningful and necessary supports, like support for mental health and wellness and all the other things that folks are needing. Let me switch to another question that came in, and this is one that I think maybe Becky and Shaniqua, you might want to jump into first. Given stark racial inequities in many, I would say pretty much all health outcomes, how should health departments invest in preparing their workforces to be anti-racist workforces? Anyone want to jump into that? I see Shaniqua leaning forward. Are you coming off mute?
I can come off mute. I was trying to incognito, clearly not in incognito, communicate with Becky to see if she wanted to start for tag teaming the questions. But at any rate, I want to go back to something that Becky highlighted in the presentation earlier, which is as an example, and there are others, but this incredible work that New York City has undertaken, their Race to Justice initiative that's embedded in the health department. And it's not just about laws and policies and procedures to advance health equity within New York City, but also a critical component of that is training their workforce internally. So for, New York City's health department is big and vast, like 6,000 plus people. And it's extraordinary what they have done, because they have incredible curriculum broken out with several different modules. And then folks they have operationalized this training of their staff to be in line with how the department as a whole is structured. I raise that up because of the practicality and the challenges that can come with training a workforce, training your staff what does that look like? What can you utilize? How do you make the time for all of that to happen, while of course addressing really critical needs in the community? So I would very much advocate for checking out that initiative. And then the other thing I will say, and Becky hopped in here, frankly, is to look back on Change Lab's journey as an institution, because I don't think we're very different from others, in that a key recognition that we had in order to advance health equity in the work that we were doing, that we could not separate the internal work that needed to be done as an institution, but also the internal work that you must do as an individual. And all of these things go hand in hand. They're not sequential. There's no chronological order. It's actually, you need to systematize it and frankly, do it at the same time. And that can be challenging. Becky, I don't know if I've left something out.
No, I think you did a fantastic job there. I think the other thing I would flag is, there's a lot of differences among health departments across the nation. And in some places we've heard where they're not allowed to say the words equity or racial equity. And so what does that work look like in places like that? And I know of health departments who are in those environments who are still trying to move the needle in this space by constantly bringing the data to the conversations, building partnerships, I think, with external partners who can do things that, it's an inside outside when you're talking about government. Sometimes when you are constrained by what the legislature is allowing you to do or say, pulling in your partners who can make that, who can make that case for why you need to do that change is really important. So, and figuring out ways where you can still do the work even in an environment that's hostile, right? So I think when we think about this, yes, absolutely, everything Shaniqua said, and if you're working in a climate where it is harder, really being strategic, figuring out who your partners are, bringing that data, having those conversations, using different word choices so you can get through the clearance process or whatever the review process is, but still pushing the needle wherever and whenever you can.
Thank you for that, and appreciate your recognition that people are working in environments that are more or less conducive to some of that work. I did want to give a section to Kyle. I know that the CDC is undergoing its own internal work to sort of pick up on that theme, and has this whole CORE initiative, CORE initiative, to sort of drive and promote health equity within the CDC itself. And the E of CORE is enhancing capacity and workforce engagement around sort of health equity. So I'm wondering, is there anything that you have that you want to share? Don't mean to put you on the spot, but I think it's important for people to know that the CDC itself is engaged in this.
Yeah, I think recently the CDC has really taken, I think, a really forward-facing and proactive approach around issues around diversity, equity, inclusion, and accessibility in all of its work. So it's no longer kind of just the side thing that someone works on. It is permeating everything that we do. And within the workforce area, we've really committed to figuring out, again, this sort of analogy of the tree and the acorn. So there were things that we probably should have done 20 years ago that we would have benefited from, but we want to try and get some things going now. So for example, in all of our fellowship programs, we ensure that everyone doing interviews and assessing applicants undergoes unconscious bias training, because we know that there are issues around bias in selection of people for fellowship programs. And that's just one avenue in which we can try and increase increase the workforce from a DEIA perspective. We also have issues around diversity, equity, inclusion, and accessibility as case studies in all of our fellowship programs to try and interweave these issues into existing public health frameworks that I think have often been missed. So it is an exciting time. I can't speak about everything that's happening agency-wide, but there's definitely been a change in perspective where there's been an overall embracement of this being critically important as a public health component, but also as an agency, something that we need to address as a collection of people from various backgrounds who work together irrespective of what the job is, that these are issues that we need to come to terms with, both with respect to our public health work, but in our own interpersonal work with each other.
Thank you, Kyle. So we have about 5 minutes left, and I'd like to squeeze in 2 questions so that I think will be interesting to the audience. So just have a couple of you remark and keep your remarks brief if you can. So the first one is, can you share any examples of law or policy modernization pertaining to the workforce that could benefit other states or localities? So is there any real life examples of law and policy modernization related to workforce that you could share? Yes, Josh.
Well, examples might be the opportunity for certain types of community health workers to be reimbursed directly through the Medicaid program, which exists in certain states. For example, Pennsylvania has done that for people who work to prevent violence coming out of the emergency room. So that would be one example. I think there are other, maybe less direct examples. Actually, at the Population Health Roundtable meeting in Washington, 2019, on workforce, we heard from the Maryland healthcare system where it was using funds through global budgets to hire community health workers to really improve population health in different parts of the state, particularly in Baltimore City. So that's another, it's sort of a little bit indirect. It's not paying them directly, but it's using the payment system to support a shift. So I do think that's definitely a promising workforce strategy. The other one that I would just mention, and I think Becky and Shaniqua were talking about it a bit, are the laws that explicitly protect public health workers from harassment, and those are starting to be considered, and there's some good examples of that, some of whom which I think have passed.
Great. And if you have any example or links to any of that, maybe you can. We'll have to figure out how to collect that, but I'm sure the organizers will put that in. They have those great resources that they've pulled together. And so if they aren't already in there, we can sort of add them to that. Anyone want a 30-second addition to that? Okay. If not, I'm going to go to the next question. And this really is around the public view of workforce and issues around trust and recognition. And so I think, starting from what Marilyn shared with us in terms of how, people who were in it for the sanitarian sort of movement and sort of what some of their sort of motivations were, what suggestions or actions do you have or would you recommend around that trust piece and in the workforce, recognition of expertise and experience, and how does the workforce confront that?
I can start us, unless Josh, did you want to?
No, go ahead, Becky, please.
So there are things I think I liked, was it Josh who did the latent versus active? I think in the trust equation, this is not going to be something that changes overnight. This is going to be something that's decades long, because it's been really centuries in the making, the breakdown of trust, right? And so I think this is where community-based organizations become a really important partner in this work, rebuilding relationships, having dedicated time for public health practitioners who are in government, to go out and go to meetings. It doesn't just mean having a meeting at your place where people have to come to you. It means going to churches, going to schools, going to festivals around town, going out and meeting with the community, partnering with community-based organizations to rebuild that trust, and partnering with different sectors who can maybe activate different strategies on social media and whatnot to break down the misinformation. Just to name a few. I don't know, Shaniqua, if there's anything else you would want to add to that.
I would just, to round it out, many of the strategies and things brought up in this panel today around training up our workforce, getting to the youngest of folks. And so to Becky's point, this is not something that would change overnight, but the workforce very much needs to reflect the communities in which it serves. And I think a number of things that have been raised today and strategies can help to facilitate that, but it will take some time.
Thank you. So I want to give each of you like a minute, 45 seconds, not even a minute, 30 seconds before they cut us off. Any final thoughts or parting words or things you really want people to take away from this session? So I'm going to start with Marilyn, if I could.
I think the past couple of years have been very confusing for a lot of us. I think a lot of us at the very beginning of the pandemic, as some have alluded to already, thought that because public health was front and center in everybody's life, there would be a restoration of faith in the enterprise. And I think that has happened to some extent, but I think we've also seen some real disappointments too, and some of it rooted in the fraying of trust. But I don't want people to forget that early moment, I guess, because I do sense the morale has been on a downswing for the past 6 months or so. This is just my impression. But if we can re-tap into some of that potential and the wider horizons that we were thinking about in the early days of the pandemic, where we said, after this, we can rebuild something better. I think that's worth thinking about, because the worst thing I tell all my students, especially when things are don't look so great, at least in the short term, is don't lapse into cynicism. It's a very privileged position to just roll your eyes and be cynical about the world and make little jokes about it. But some people can't afford cynicism, and I think we all have to remember that, no matter where we are in the workforce, broadly defined.
Thank you, Marilyn. I appreciate that. Josh and Kyle?
Sure, I would just say, there's this thing on the internet, would you rather be invisible or fly? And, the public health workforce has kind of been invisible for a long time. And through the pandemic, not so successful a strategy, and we obviously aren't invisible anymore. And so now we're becoming more visible. Part of that is looking at ourselves in the mirror, like we've talked about. That's something certainly we're doing in Johns Hopkins, but CDC, Change Lab, all organizations should be doing that. But then the other part of it is being prepared to fly and to tell the story, have people recognize the value that public health brings, find partners to fly with us. I think it's a different world we're in post the pandemic, and history informs that world, but we're not necessarily bound to have the same experiences that we've had before.
Agreed. Thank you. Kyle?
That was a great analogy. I like that, invisible or fly. I would pick both. I don't think you can pick one or the other. But I would just like to add that it's as Melvin had suggested, or Marilyn had suggested, it's been a really difficult few years for, I think, the country as a whole, irrespective of public health. And it's been exhausting. I think many of us on this call are tired. But I also think there's a lot of opportunity, and there's a lot that we can change, and there's a lot that we know now that we didn't. And I think there's a lot of will that did not exist before. So in my efforts to remain a positive 2022 citizen, I think where there's challenges, there's opportunities. And I'm really excited about the amount of resources that are coming with respect to bolstering the workforce, and opportunities to really think about how we can leverage those resources the most effectively to have the longest long-term impact.
Thank you, Kyle. And Becky and Shaniqua, you get one. You have to go right, pick this is 30 seconds.
I'd be quick to Becky so we can wrap it up.
I just want to kind of take it back to what Marilyn said a little bit at the beginning. And this is about Jon Snow. We often think Jon Snow, he went around, looked at the cholera outbreak, created this nice data set, went to his version of city council and said, hey, let's take off this handle. And everyone was like, great, yes, done. And the reality was that was a contentious process. And so this process we've been through over the last several years, it's not a new process. It is something that's going to keep happening. And I think we just have to keep at it and recognize that this is a marathon and it's not a sprint. And if you're looking for resources to help you with that, I would strongly recommend checking out our website, changelabsolutions.org. We have numerous resources, and we are available for technical assistance if you have questions. Thank you.
So thank you all. Want to wrap this up. It's clearly you could have spent, a whole nother hour just diving into the history alone, let alone all the other pieces that you all were sharing with. Want to thank you each and every one of you for participating and for sort of being part of this conversation, and let you know that we're going to take a break until I believe about 1 p.m. Eastern, and the organizers will share some updates with you about that. But to this panel, really want to thank you all